colleagues, to my partners that helped make this initiative a reality.
When they had the training,
come on in.
just a couple of weeks ago.
The postpartum one?
The multi.
I like a tight frame. The cameras are over here. Dr.
I
Bennett.
remember with the oil, the oil.
Yeah, I was there.
Yes. Okay. It's hard to remember.
All right, to the members of the press, can you see my crew behind me? They're in the frame? All right. Where's, wait. Javon Muhammad?
I have a birth.
Bring the baby. Hey.
Superstar!
I want to thank everyone for being here. I want to start with some staggering statistics. First of all, you may not know this, but out of all the African-American births in the city and county of San Francisco, that it's actually 5%. 23 of them result in 23% result in infant death. And so what we've come today to talk about are the staggering statistics for women that are delivering babies, particularly women that are delivering preterm babies. And for those of you that haven't had any children, such as myself, that had to look up the term preterm, that means a baby that is delivered before 37 weeks. A full-term baby is usually delivered between 39, or anytime after 39 weeks. So today, with this wonderful group of folks behind me, I'm excited because we're announcing a new initiative in San Francisco to provide access to care for mothers, offering doula services for those families at risk of poor birth outcomes. I want to acknowledge our friends from the Department of Public Health, and as well as our sister friends from the Sister Web, who are also going to be speaking with you today. Across the nation, women of color, particularly African American women and Pacific Islander women, are disproportionately impacted by adverse medical outcomes when it comes to delivering their baby. In San Francisco, 13.8% of African American mothers and 10.5% of Pacific Islander mothers have preterm births, compared to only 7.3% of our Caucasian mothers and sisters. Recent research shows that Black women in San Francisco and other Bay Area counties reveal that most women from these communities feel disrespected, they feel stereotyped and coerced through their maternity care interactions. So this issue, for me, is an issue of equity, it's an issue of fairness, and most importantly, it's an issue of respect. Black and Pacific Islander women have the highest rates of prenatal, obesity, hypertension, and diabetes in San Francisco. And many of you have worked with me in the past to work to change those health outcomes, whether we were fighting the sugary beverage industry or we were bringing reforms within the police department. Either way, they all tie together and they all have a health outcome and have an impact on health for members in San Francisco. And I'm here to stand with my army of men and women to say that needs to change. That's why today I'm excited to announce that we're creating a program which would offer prenatal care through the doula access to low-income women in San Francisco. In San Francisco, even the most affordable doulas cost around $800. The median annual household income for Pacific Islanders and African American families in San Francisco is around $23,000 to $30,000 respectively, so that many of these families in reality cannot afford a doula. This project will build and evaluate a community-based doula program that will provide culturally appropriate doula care to low-income African American and Pacific Island women in San Francisco. Now, across the nation, community-based doula programs have shown to improve birth outcomes, specifically for low-income women of color. And starting in January of 2019 and June of 2020, Sister Web will build and grow a workforce as well as an infrastructure that is essential to sustain a community doula program to serve San Francisco's communities. Now, I just want to share with you a little bit about the Sister Web. It's a San Francisco-based community doula network that trains, supports, and sustains doulas from diverse communities. We are fortunate to have them to serve as the lead agency for this particular program. I'd like to acknowledge a few people that I'm incredibly grateful for. First, I want to recognize our leadership within the San Francisco Department of Public Health. Specifically, Barbara Garcia was the one that was really instrumental in helping us streamline this program and take it from a thought to creation. I want to also recognize my former legislative aide who is not with us today, Brittany Chiquata. She delivered her baby, a healthy baby boy, just last Thursday. I want to recognize our other partners. We've got the San Francisco Foundation, we've got Sutter Health, and of course CPMC for their funding support. We also want to recognize Sister Webb, Expecting Justice. Are you there? UCSF, California Preterm Birth Initiative, of course, our ever faithful Zuckerberg General Hospital, St. Luke's Hospital, who's also with us, the Teenage Parenting Program, Black Infant Health, Homeless Prenatal, for their outreach, support, and as well as their services. And I would be nothing. I'd be standing here by myself if I didn't have my colleagues with me. I want to recognize Supervisors Tang, Ronan, Yee, Brown, Safai, and Mandelman, who are standing up here with me today. And I want to thank them for their support. I also want to recognize, Sandy Fewer. That's very important. Sandy Fewer, my apologies to my colleague Sandy. And also want to recognize former supervisor, now assessor, Carmen Chu, for being also a supporter of today's initiative. Now, we've got some very thoughtful speakers that I want to recognize. First, I want to recognize Dr. Zaya Malawi from the Department of Public Health. Champion from day one, Dr. Malawi.
Thank you so much for having me here. 1 year ago, I was hired to start a citywide collaborative focused on making births healthier for the communities with the highest risk of bad perinatal outcomes. In San Francisco, those communities are the African American and Pacific Islander communities. Our collaborative includes leaders from across the city, both government agencies and nonprofits who recognize that healthy cities start with healthy births. Our collaborative is also led by Black women from San Francisco who themselves have given birth to preemies. We are stronger for having their knowledge and lived experience guiding our decisions. Our collaborative has decided to call ourselves Expecting Justice because we realize that creating an environment in which Black and Pacific Islander women have healthy pregnancies is not just an issue of medical innovation, but rather an issue of justice. Increasingly, research is showing that it is racial stress which causes Black babies to be born premature. And San Francisco can be a very stressful place to live when you are Black or Pacific Islander. Black women have premature births at double the rate of white women in this city. The median household income for Black and PI families in San Francisco is less than $30,000 a year. Gentrification has taken a huge toll on our communities. Our children are overrepresented in school suspensions and juvenile hall bookings, but underrepresented in our city's highest performing schools. Our communities are over-policed and underemployed. Babies are the record keepers of our society's decisions. And so it is not surprising at all to me that Black women in this city have premature births at such high rates, and that Pacific Islander women are also suffering under this burden. Our city's legacy of redlining, segregated schools, and urban renewal doesn't just go away. It continues to affect us, all of us, including our babies who have only just started their lives. This issue doesn't just fix itself. It requires corrective action. It requires us to put back the resources that were extracted from our communities through these horrendous historical practices. This is why I am so excited about this initiative. Funding a community-led, community-staffed doula program is the corrective action that this city can be proud of.
Yes.
I want to thank President of the Board, Malia Cohen, Sister Webb, UCSF California Preterm Birth Initiative, the members of Expecting Justice, and the San Francisco Department of Public Health for taking this important step towards justice. I want to challenge other city leaders, both public and private, to follow the example of these groups up here and make the investments in the communities that have borne the burden of racism for so many years. I want to encourage everybody to take the corrective action towards justice so that together we can make San Francisco a city where everybody thrives. Thank you. It is my pleasure now to introduce Dr. Ayanna Bennett from the San Francisco Department of Public Health.
Before we bring up Dr. Bennett, I just want to recognize we've got some leadership that should be standing on stage with us. I want to recognize Ms. Patsy Tito, the Executive Director of the Samoan Community Development Corporation, and of course my good friend Neo Bea, who's also leadership within the Samoan community. Thank you for being with us today. Dr. Bennett.
Hello, everybody. What a bright, exciting group. I feel really hopeful. I already did, but you make me more. So this is one of, as Isaiah says, one corrective action, but it is only one. And we expect all of these things to build infrastructure and build capacity of the community to help heal itself from all of these burdens that we've placed there. And we expect everyone around them to start to make things more just so that those burdens are lightened. In the Department of Public Health, we've been working on this issue for 3 or 4 years in the larger context of Black health. I lead something called the Black African American Health Initiative, which was started by Director Barbara Garcia to respond to data that said that in birth, in chronic disease, in all kinds of ways, the health of Black people in this city, and Pacific Islanders too, honestly, if you can look at all the groups that are suffering, is really not where it should be. On average, we are a healthy city, but the average is not our job. Our job is everybody. When you break those numbers down, there are people who are doing remarkably well and people who are not doing as well as they should be, not by far. And so this is one of those ways in which we look at all the data, look at everything we're doing, and break it down to say, who are we actually serving? And if we're serving everybody, does someone else need more than they're getting?
Right.
And even if we are serving everybody, there are clearly people who need more than they're getting. And that is true of our Black moms. It is true of our Pacific Islander moms. And this is one thing we're doing to try to correct that. We are going to be working on hypertension. We are working on alcohol use. We're working on a lot of different fronts, and we're hoping that we'll see more and more of that and more collaboration from others to work on all the fronts in which we need to make more change. Thank you.
Next, we will hear from Marna Armstead, Black Doula at Sister Web. Oh, excuse me, we're going to hear from Javon Mohammed. I don't know. We'll hear from them both. You both can stand together.
I gotta bring my baby up here. So, thank you for having me. My name is Javon Muhammad. I'm the Chief Executive Officer of the Baby Hunters Point Clinic. I am so excited to stand here today, but more so honored to be able to address this outrageous disparity that exists in the United States of America, where Black women and their babies die during the perinatal period. We lose our babies during pregnancy, and we lose our babies when they're infants, and it has to stop. But to do that, we need doulas. So it's not a luxury, or it shouldn't be a luxury, and it has been a luxury to have a doula.
Right.
We need doulas because the reason we die, as someone said, one of the reasons we die is because of racism. And somehow we keep addressing racism from an academic perspective, which will never be successful.
Right.
Because we're not dying from an academic perspective, we're dying from decades and centuries of racism that we're carrying with us from our grandmothers and their mothers and their mothers and their mothers and their mothers. So when we receive someone into an office and they come in and we know that it looks grim for them, we can't tell them to take a bath to get rid of the stress. We have to have women who can support them, who walk with them during their pregnancy, and who address things like the lack of good food, the lack of housing, especially in a city where we're being pushed out because we cannot afford housing. We talked a little bit about babies dying, but in San Francisco, mamas die. Black mamas die.
Right.
Half of the deaths have been Black women. That is a public health crisis. And we need other black women to stand with them, which makes gentrification a public health crisis. So we have to stand together, and I'm so excited that this, I've been a midwife for over a decade. In addition, I caught this baby, which is why I had her up here. Because her mama had a doula. I have 5 grandbabies. I've been blessed to catch 4 of them. They all had doulas. Doulas not only save lives, but they save the taxpayer money. Because when a woman has a doula, that doula is a master of distraction. And she prevents that mom from getting unnecessary interventions that lead to death of the mama. And there is not 2 patients. When a woman comes into your care pregnant, there are not 2 patients. It's 1 patient. There's no success for a baby if the mama is sick.
Say that.
Doulas help mamas walk their pregnancy so that they deliver healthy babies and so that we create stronger society. I'm happy to be here in this first step. Hope the second step is to start to address gentrification and what happens when there's not enough mamas to support mamas. Because they all live in Antioch.
Right.
So we still have work to do. And again, thank you for having me.
Afternoon. I would like to give honor to the great I am God that I serve. He is my provider and the reason why I'm standing here today. I also want to give honor to Mayor London Breed, President of the Board of Supervisors, Malia Cohen, Dr. Zaya Malala, Dr. Diana Bennett, Dr. Javon, and the great city of San Francisco from where I was born and raised, and I am proud to say I still live here. Today I'm especially proud of a city that I've lived and worked in for over 40 years. I will speak to you today as a woman, a mother, a doula, and a community birth worker in the city I love with the hidden and not so hidden crisis. All of these speakers spoke a lot about the health disparities and the issues in San Francisco, so I won't rehash that. But I want to talk to you about the community birth workers. I'm a doula, community birth worker in San Francisco. And doula work is a profession that I love, and I love doing this work. And anyone who is a doula or has a doula or has been in that job, you know you have to love it to be there. So I love that work. Many people believe that doula work is free or it's a volunteer situation, and it is not. It is a profession. We are supposed to be paid, and black doulas end up not being paid. So it creates a situation where many black doulas and other women of color, doulas of color, they work for very little or no pay, and then they can't continue to do the work that we love. You know, we can't continue to support women when we're not being cared for. In my experiences, I spend days away from my home, days away from my own daughter when I go in to help another woman have their baby. And it's just not a sustainable thing when you're not being paid. So a lot of doulas have to stop their work and go back to their regular jobs, and we lose black doulas. And so to have this program, the Sister Web program, and this special collaboration partnership is an absolute dream come true to me. So a team, Ali Cuentos, Angelita Bourbon, and myself, we created Sister Web. And so I'm going to read from here. Sister Web is a doula network created to meet the needs of black women and other women of color that are either doulas or in need of doula care services. Sister Web will use experience and wisdom of new doulas to lead the initiative. We'll create a model that is dignified and sustainable for doulas, and will peer match these doulas with birthing women in the cities of San Francisco. For example, Black Doulas for Black Women.
All right, all right, all right.
Dream come true, because it means I'll be able to work in a profession that I love, and so will other black women of color and other doulas and women of color in San Francisco. And if we can work within our communities to improve birth outcomes for both mothers and babies, we really have the building blocks to change our city one birth at a time. I'm grateful for a forward-thinking city like San Francisco that will allow implementation of a program like Sister Web. I'm grateful to be standing here representing Sister Web as a pivotal resource to the San Francisco birthing community. Thank you, San Francisco, once again for being a pioneer to the nation where women can birth and raise their families in a place that is safe and welcoming to all. Thank you.
Thank you very much, Marna. Thank you and your expertise. I want to give my colleagues a moment to come and speak. Supervisor Mandelman will say a few remarks. Assessor Carmen Chute will say a few remarks. I think that's all we'll hear from. Oh, and Supervisor Safai.
Hello, I'm Raphael Mandelman, Supervisor from District 8. I will be very brief. I do want to thank President Cohen for getting us out here today for this extraordinarily important issue. I, as the District 8 Supervisor, am particularly proud that Dr. Malia is a District 8 resident and constituent. District 8 is well represented here. Also, Dr. Jonathan Fuchs with the Preterm Birth Initiative. Thank you for all of your work. This is such an important issue, and I'm so struck by one of the comments of the earlier speakers that in San Francisco, a city of such incredible wealth and also inequities, average is not our job.
That's
Equity
right.
and justice is our job. Thank you, President Cohen, and thank you to the community members and partners who are here with us today.
Hello, my name is Carmen Chu. I serve as San Francisco's assessor. I'm very pleased to be here to join with President of the Board, Malia Cohen, and for her leadership in pushing forward this program in San Francisco. You know, I think for many of us, when we think about people who have given birth, we always think that there are no problems. It's such a common thing these days that we think people don't have complications or that mothers survive. And that's not always the truth. That's not always what happens. And so when we're able to have programs like this Doula program that helps women survive, in particular where we see health disparities, I couldn't think of a better use of our funding and a better use of our resources, trying to make sure that those disparities are kept to zero as much as possible. So again, I want to say thank you to President of the Board, Malia Cohen, for her leadership, and look forward to seeing this program save lives. Thank you.
Thank you so much to President Cohen and all of the wonderful partners here on stage and all of you out in the community. Our office has spent a lot of work, as you know, working on trying to help mothers in the workplace with lactation and so forth. But really, we have to rewind and go back to even before a child is born so that mothers know what it is that they need to do to take care of their babies, but also themselves, and that you can set people on the right path. And so I just want to thank you. I can't believe we haven't had a program like this. And so this is really exciting, and really hoping to see it really take off and other cities also really use this as a model so that we could see this nationwide. So thank you, President Cohen.
Hi, I'm Hillary Ronan, the supervisor for District 9, and I just have to say thank you. I have to say, at a time in this country's history when the President of the United States and the Supreme Court is attacking women's health, that here in San Francisco, we are going in the opposite direction. Whether it was last week celebrating the opening and the saving of New Generation Health Clinic for teens' reproductive health, today Supervisor Cohen, President Cohen's amazing announcement of this new program to save the lives and eliminate disparities with African American women and Pacific Islander women. We are once again leading the nation on what it means to protect women's health and to have women take care of our own communities and our own health and bodies. So thank you very much. It's a really exciting day.
To be real brief, again, my name is Supervisor Asha Safai, and I just stand here in awe. I truly stand here in awe because it means something to have strong female black leadership in this city.
Say that. Say that. Say that.
We have an African American woman leading our board of supervisors. We have an African American woman leading our city. And now we have leaders from the Department of Public Health, African American women putting forward an issue that disproportionately impacts their community, working with community-based organizations. And some might say this is a small step, but it is a big step in changing perception and opening up opportunities for health for the Black and Pacific Islander community. So let's give it up for strength, empowerment, and justice. Thank you.
Ladies and gentlemen, this pretty much concludes our very short program. Needless to say, this isn't about the individual, this is about the collective. This is about the collective movement to continue to save lives. and we want to make sure that we're not leaving any woman behind. So with that, I'd like to say thank you for your leadership, and thank you for your work out and being on the front line and serving, and to the members of the press, thank you for covering this very important story. Thank you.
You want to tell me your...
Reach out to all of the folks that would like to join in a group shot right here on the stairs of City, right here on the stairs. Please come with your signs if you're a healthcare worker or a doula or a midwife or just support the cause. Come on up.
All right. Can you tell us your name and why you decided to be a doula and how long you've been a doula?
My name is Yolanda Carter. I've been a doula for over 10 years.
Okay.
And like it is said, doula saves lives.
All right.
At birth, no woman should be alone and should always be held by a doula, which is why I became one.
Do you know how many babies you've helped deliver?
I have delivered at least 40.
40 babies? Are you only in San Francisco, or do you go where you need to go?
All over the San Francisco Bay Area.
Thank you so much for sharing.
All right.
Oh, go get up there. Go. I'm sorry. No. Go. Sorry. Picture time. Excellent. Woohoo! All right, and we're out.